Good evening, my name is Raul Peralta, which is about Nasal High Flow Therapy in preterm infants. Account. In the keywords, infant 11 complete weeks of gestation, more than 3 weeks before the infant's 28 weeks. Then therapy is respiratory support with oxygen plus compressed air and humidification considers sinus positive pressure into the airway of the lungs, windpipe open during sleep. It collapse that block the breathing in people.
What is neonatal respiratory distress syndrome? Neonatal respiratory distress syndrome is a syndrome in premature infants caused by developmental insufficiency of surfactant production and structural immaturity in the lungs. So basically, in this condition, there is surfactant deficiency, and as we mentioned, surfactant is what decreases the surface tension. So if you have surfactant deficiency, there is going to be an increase in the surface tension, which is going to lead to increased work for breathing, and therefore leading to alveolar collapse. What diagnostic test is indicative of neonatal respiratory distress syndrome? A diagnostic test indicative of neonatal respiratory distress syndrome is lecithin sphingomyelin ratio of under 1.5 in the amniotic fluid. So if it is under 1.5, this is predictive of neonatal respiratory distress syndrome, where if it is over 2, this means that the lungs have fully matured. What are some complications that can arise due to neonatal respiratory distress syndrome? We already mentioned that neonatal respiratory distress syndrome can lead to alveolar collapse, but because there is a persistent low oxygen tension, there is a risk of patent ductus arteriosus. Now, to understand this, we mentioned in the cardiology chapter that you need high oxygen tension after birth to close that PDA. So when you don't have that in neonatal respiratory distress syndrome, it will keep the ductus arteriosus open. Now, to correct the low oxygen tension, if you are to give supplementation of oxygen, this can lead to too much oxygen in the neonate, and that could lead to additional problems such as retinopathy of prematurity and bronchopulmonary dysplasia. What are the risk factors of developing neonatal respiratory distress syndrome? Neonatal respiratory distress syndrome, as we already mentioned, occurs in prematurity. Also, if the mother has diabetes, this can lead to premature delivery. And lastly, cesarean delivery can also lead to this due to the decreased release of fetal glucocorticoids. What are some treatment options to correct neonatal respiratory distress syndrome? The treatment options for neonatal respiratory distress syndrome includes maternal steroids before birth to speed up lung maturity, or you can give artificial surfactant for the infant.
For more information on this topic, click on the
Medicine. A high work of improve to eliminate most of a respiratory nasal cavity. Gas keeps fluid and aids irreducible rate, less dyspnea, and more allows to oxygenate blood in respiratory pathology is easy of setup.
So you're getting about 90 breaths, and so now he has a VSD and an ASD and a little pulmonary stenosis, I guess. But he's been sick and coughing, no fever though. You said right, but he's been coughing and he had a period of apnea. Is that right? He just stopped breathing on Monday.
Yes.
And someone had to blow in his face.
Yes.
Is that right?
He got choked. He get choked off of that whatever he's coughing.
Okay. But he's only had like what, 2 ounces today, you said?
That's all.
Yeah.
When he started coughing, he turned blue.
Ecuador, one is the second of those
p.m. Eastern Time. Columbia University medical experts from Morgan Stanley Children's Hospital of New York Presbyterian will host a webcast discussion on the use of bubble CPAP therapy for newborns with respiratory distress syndrome. CPAP stands for Continuous Positive Airway Pressure. Bubble CPAP is a low-tech, labor-intensive therapy that is performed to prevent chronic lung disease.
Chronic lung disease is a serious problem. Not only does it prolong hospitalization and make the hospitalization that much more complex, placing the baby at risk for things like nosocomial infections, but chronic lung disease is also associated with poor neurodevelopmental outcomes. So avoiding chronic lung disease is a worthwhile goal.
Just minutes following the birth, pressurized oxygen is delivered through prongs in the baby's nose.
Any infant who's spontaneously breathing, irrespective of his birth weight or his postmenstrual age, he should be given a trial of nasal CPAP.
Bubble CPAP provides breathing assistance for babies as opposed to a machine doing the breathing for them. The Neonatal Intensive Care Unit at Morgan Stanley Children's Hospital of New York Presbyterian is a proven leader in this non-invasive technique and has among the lowest incidence of chronic lung disease in the world.
It's an expertise that one has to develop. And the expertise not only involves doctors, but also involves nurses and respiratory therapists. It's a team effort.
During the webcast, doctors will also discuss the operational functions of the hospital's CPAP system.
We use the oxygen blender to control the oxygen concentration for the gas sources. We immerse the distal tubing into the water to control the CPAP pressure, and we connect the CPAP circuit to the patient with a Hudson nasal prong CPAP.
Anytime during the webcast, viewers can submit questions to the panel via email by clicking the mDirect Access button on their computer screen. You can watch this internet broadcast.
In conclusion, high flow result in a significantly failure than did nasal continuous positive airway pressure or CPAP.